Hey class, in this video we are going to continue the discussion on the sixth meridian differentiation. In the previous videos, we have introduced the three yang meridian syndromes, and in this video we are going to study the yin meridian syndrome. The causes of the yin meridian syndrome, especially the first one, the tie-in syndrome. The tie-in syndrome may from the development from the yang, from the yang syndrome, become further deeper and deeper, go to yin. It also can be the pathogen attack the yin directly. So after the study of each syndromes, we're going to show you a very brief diagram, the causes of different syndromes, the manifestations of yin syndrome. The patient may present with abdominal fullness, nausea, loss of appetite, watery diarrhea, no thirsty, abdominal pain. This is due to the cold and dampness affecting the spleen yang. So this situation, the patient will present with spleen yang deficiency and results in the cold dampness, and the cold dampness again affects the spleen yang to make the spleen yang worse. So this is a vicious circle. For the analysis, you're going to focus on the coldness and dampness. So this is very similar to the 脏腑 manifest or 脏腑 organs. The pale tongue is from the coldness. Also, white coating from coldness. The patient may present with slippery coating, that's from the dampness. The coldness affects the spleen and stomach, will cause nausea and poor appetite. The watery diarrhea, that's from the dampness. The key manifestations: fullness in the abdomen, abdominal pains, watery diarrhea, no thirsty. When we study the diarrhea, poor appetite in the 脏腑 organs differentiations, we always think about the spleen. So the yin meridian, the foot yin meridian, that's the spleen meridian. So this is syndrome, the yin syndrome, mostly related to the spleen. When you say yin meridian syndrome or the yin syndrome, they all related to the spleen. This is very similar when you talk about the spleen yang deficiency from 脏腑 organs. As you can see here, we got another connection from the meridian and the 脏腑 organs. We just want to understand, try to analyze from the other way. This is very similar. Some people may have more than one names. You might have your name from your ID book. You also your friends may call you from the other nickname. So but these two names are all referring you. This is the yin meridian syndrome and the spleen yang deficiency syndrome. These two are quite similar, although they are not exactly the same. The treatments we're also going to analyze with the other manifestations. A Saline syndrome. A Saline syndrome is a deeper condition of a yin syndrome, a deficiency called syndrome due to yang deficiency. The yang deficiency can be the heart and the kidney. You still remember that's the relationship between the heart and the kidney. When we study the last session of the Zangfu differentiations, we have talked about the relationship between the heart and kidney. The patient will present with chill alone, no fever, only aversion to cold, sweaty pulse, sleepless, extreme cold lumps, diarrhea, because of the yang deficiency. The patient got kidney yang deficiency, got the heart yang deficiency. Can you imagine the patient will have spleen yang deficiency or not? The reason the patient is more likely to have spleen yang deficiency. That's why diarrhea with stool containing undigested food. There's also spleen and kidney yang deficiency. Vomiting, poor appetite. So these are the key manifestations. The cause of the Saline syndrome, the causes of Saline syndrome, also can be the pathogen attack the Saline directly, or from the Yang syndrome, or even from tie-in syndrome. The Saline syndrome also can develop into cold condition and a heat condition. That's due to the body constitution. The patient will feel chills, sleepless, extremely cold lumps. The key manifestations: chills, cold lumps, diarrhea, and very weak pulse. That's due to yang deficiency. So these are the key manifestations. Saline heat transformation syndrome. The previous one is Saline cold syndrome, the Saline heat syndrome. That's due to how can they transform into heat? That's due to the body constitution. In this situation, the pathogen will be changed into heat, restlessness, insomnia, tongue is dry and red tip. That's from the heat. Sweaty. That's because of yin deficiency. So as you can see, this heat is the deficiency heat. So the patient will feel restlessness, insomnia, yin deficiency, especially the yin deficiency in the kidney, Saline, the foot Saline kidney. The Jue-yin syndrome, the Jue-yin is lack of yin. Jue is lack of yin. So in this syndrome, the yin is very limited, and Jue-yin syndrome is one of the most complicated syndrome. The reason is also from the text, from the books originally. Under Jue-yin syndrome, the manifestations varies from many different aspects. It includes weight loss, thirsty, a feeling of qi rushing up to the chest. What kinds of feeling describe that this? The patient can describe that they can feel something moving up from the abdomen to the chest. They can feel something moving up. So that's a feeling of qi rushing up to the chest pain with a burning sensation, hunger but no desire to eat, vomiting. So these are the manifestations of 厥阴 syndrome. This is the later stage of cold-induced condition. It can be either yin or yang because it's the last stage. Also depends on the body constitution. Key manifestations. Symptoms: upper heat. In the meantime, the patient also may present with lower coldness. So upper heat with lower cold. Chest pain with burning sensation. Hunger but no desire to eat. The patient also may present with diarrhea as the coldness. Cold lumps. These are the key manifestations of a 厥阴 syndrome. So where does the pathogen come from, or where does the symptoms come from? What are the possible causes? Firstly, the pathogen can attack 太阳, the superficial. So 太阳 is the early stage, the initial stage of the disease. So go to the 太阳. The 太阳 can develop into 阳明, develop to the 少阳. So it can develop further and further, and the disease become worse and worse. It can develop in orders, one by one. You also can jump. 太阳 can develop into 太阴 directly. The pathogens also can attack the yin directly. So if there's a question asks you what are the possible causes of a 太阴 syndrome, now you can think about the pathogens, the exogenous pathogens, the direct attack. You also can think about the 少阳 developing, or the 太阳develop to 太阴. So these are the possible causes. Similarly, the 少阴 also can be similar. So that's the possible causes of the diseases. Now we go back to the patient that we have seen at the beginning of our video. A gentleman 26 years old with an urination problem, aversion to cold and fever, fullness of the lower abdomen, first with desire of water, white, greasy tongue, floating pulse. The patient caught a cold 1 week ago, or common flu 1 week ago. So as you can see, when you see this patient, the patient suffers from exogenous pathogens attack the meridian. Which meridian and which one has been affected? You will see that the urination. So this is a 太阳 water retention syndrome. The reason is because the patient suffers from exogenous pathogens. The patient still have the exterior syndrome from the superficial, floating pulse, fever, chills, and the patient also presents with the urination problem. The patient may have thirst with a desire for drinking. The drinks also may vomit immediately. The second patient, 31 years old female, chronic diarrhea, 4 weeks, aggravated because of the cold food, fullness of the abdominal, poor appetite, essence of thirsty, abdominal pain, preference for warmth, pale tongue with white greasy coating, weak pulse. So this patient with diarrhea, pale tongue, tie-in syndrome due to the coldness, diarrhea. The spleen yang deficiency results into the loose stool or even diarrhea. How do we know the tai-yin yang spleen yang deficiency? When the patient eats cold food, it makes them worse. That's also another sign of the coldness. So that's the tie-in syndrome. In the treatment, we can use either herbal medicine or acupuncture to tonify the spleen, yang. These are the brief introduction of the sixth meridian differentiation method. As you can see from the discussion, the Zangfu differentiation and the sixth meridian differentiation, they are connected. There are some relationship between these two different differentiation methods. As I said before, this differentiation method is a 1 full year course. So we won't be able to discuss in details of each syndrome, and under each syndrome, there are more different syndromes under each Tai-Yang syndrome, Tai-Yin syndrome. Then there are more different subsyndromes under each syndromes. So if you are interested in this differentiation method, you are more than welcome to find more references and read them. The classic of 伤寒杂病论 or 伤寒论 has already been translated into English, so you should be able to find the original text of this classic if you are interested in. Thank you for your attention.